am recording the lungs, thorax, heart, and neck vessels for my head to toe assessment. First, I'm going to start with the patient's posterior chest, and I'm going to remove his shirt and check his skin and make sure that it is all intact. It is the right color for his ethnicity. I don't see any obvious signs of breakdown, infection, tumors, lesions, anything like that, and palpate and make sure that there's no lumps or bumps or anything like that. The next thing I'm going to do is look for the symmetry of the expansion. So I'm going to take my hands and place them around his chest here with my thumbs about ½ an inch apart in the middle here, and I'm going to have him take a deep breath and out, and I'm going to make sure that his lungs on both sides are expanding symmetrically, which they are. The next thing we're going to check for is tactile fremitus, which is a vibration sound that can be felt in a normal patient. So I'm going to take my hands and place them down his lungs while he repeats the phrase 99.
99, 99, 99, 99, 99.
Very good. We're also going to check for, I missed checking his AP transverse, like his chest, to make sure it's the right width from the front to the back is not as wide as side to side of his chest. So he's at a 1:2 ratio. So now we are going to, I'm going to palpate for any lesions in crepitus, and I don't see any. So I'm going to auscultate his lungs. I'm going to start at the apex of the lungs, which is above the scapular. And every time I touch my stethoscope to you, would you please take a deep breath in and out? And when I get to the C7 to the T3, that is the upper portion of the lung that I can hear posteriorly. And I'll just go all the way down, side to side. I'm listening for good breaths in and out, no wheezing, no stridor, no rubs, no rails. And then once you get to the T3 to the T7, you are getting to the lower lobes of the lungs. I don't hear any extra sounds. They all sound very clear. Very good. And then we're going to check for the consolidation in the lungs. And so I'm going to have the patient whisper the letter E. If his lungs are consolidated like in pneumonia, it would sound like A to me. So I'm going to just listen to your lungs, and if you could whisper the letter E. Very good. Okay, now I'm going to move to the anterior of the chest. And just like before, I'm going to start with inspection, and I'm just going to kind of look at his chest and note his skin. There are no lesions, there's no breakdown, there's nothing of concern, and I can see that his respirations are normal and unlabored. So then I'm going to auscultate, I'm going to palpate first his skin to make sure there's no bumps, lumps, masses, anything that I should be worried about. And then I'm going to listen to his respirations, to his lungs, breath sounds. I'm going to start at the apex of the lung again, and this time from the front we'll go above the clavicle for the apex of the lung. So find the clavicle. Okay. And when we get to the fourth intercostal lung space, we're listening to the left upper lobe of the lung and the right middle lobe of the lung. I don't hear any abnormal breath sounds, no rales, no wheezing, no crackles, nice and clear. Okay, next we're going to auscultate his carotid arteries. I'm going to listen to make sure there's no bruise, nothing abnormal. Nice and even. And then I'm going to palpate to just see if I can feel his carotid pulses. Okay, and now I'm going to listen to his heart sounds in 5 places. We're going to do aortic, pulmonic, the Erb's point, tricuspid, and mitral, listening for the S1 and S2. So we'll start with the aortic, which is the right side, second intercostal space. It's the aortic. And pulmonic is the left side, second intercostal space. Erb's point is the third left intercostal space. And the tricuspid is the fourth intercostal space. And the mitral is the fifth intercostal space. And I hear his heart has a nice steady rhythm and a good rate. Finally, in this assessment, we're going to check for his pulses. We will go back. I know I missed something. Pulses, so we're gonna start with the radial pulses. And we're just feeling to make sure they're nice and steady. They're graded. He's at about a 2+. They're not bounding and they're not faint or thready. I can feel them nice and even. Then we'll do the brachial. On either side, same thing. They're nice and even. I can feel them nice, good 2+. Next, we're gonna do the feet, the dorsalis pedis, and we would remove the patient's sock and feel for a nice steady pulse that I can actually feel through his sock. It's a nice 2+, nice and healthy pulses on both feet. And then his this last pulse here on the inside of his foot. Sorry. We're gonna feel the pulse there, right here on the inside of the foot. I'm drawing a blank on what it's called. It's also nice and strong, not bounding, but nice and strong. Okay, when I was assessing the heart, I forgot to check for murmurs, so we're going to do that, and for S3 and S4. So actually, while you're still sitting, let's go ahead and listen for the murmur, okay?
Okay.
So I'm just gonna listen here, and if you could lean forward. Trying to identify any murmur, and I do not hear any murmurs. Now I'm gonna have the patient lie down on his left side. And listen in all the areas, the aortic, pulmonic, all the way down, to see if I can hear any abnormal heart sounds, as in like gallops or rubs. And I cannot. So that completes this portion of our assessment.